Hey guys, tonight I'm going to talk about acne, that is pimple. I talked about this disease before and people have been asking me to repeat that again. So there are some myths and facts about acne, and tonight I'm going to talk about 20 myths and 20 facts about pimples, that is acne. Okay, let's jump in. What is the first one? The first one is your diet can cause acne. That's wrong. The real fact is there is no relationship between your diet and your acne. People think that when you take oily food that can aggravate acne, but that's not true. Studies have proven that oily food and the acne doesn't have any relation. So we can have food and fat food, but it's not good for your health. But the thing is that if you think a certain diet is causing or aggravating your existing acne, that time you can avoid that food. Okay, otherwise there's no relation between your junk food and your acne. But I'm not advising to go for junk food and all. Live a healthy life by eating a healthy food. Alright, now let's check what is the second myth. Second myth is acne is a cosmetology problem. That is, acne is only a cosmetology problem. No, it can affect your self-esteem, it can affect your mood, and it will lower your confidence, and most of the people with severe acne will have depression. They are afraid to face the crowd. They are afraid to go into the public. Then the exam times, they'll be picking on their acne and they won't be able to concentrate on their studies. So this acne is not only a cosmetology problem, it is a disease which has to be treated. It is psychologically will affect children especially. Okay, now let's check what is the third myth and fact. Third myth is pimple will go away when you pop them up. No, when you pop them up, what will happen is you are destroying the skin as well as the acne. That will lead to a scar, and when a scar is formed, it's very difficult to treat. So don't ever pop up your acne. It might temporarily will give you some relief. It may not show for a few days, but when it comes back, it will come back with very aggressive mood. Okay, so next time don't pop up. The fourth one is acne is caused by oily skin. That's another myth. Even oily skin as well as dry skin can have acne. If somebody is having dry skin, they can have acne, and if somebody is having oily skin, they may not have acne. So oily skin and acne doesn't have any relation. Both the types of the skin, oily skin or dry skin, can have acne. The seborrhea, the oily skin, can plug the pores, causing acne. It can happen even in the dry skin. So don't ever think only oily skin people will have acne. The next one, the fourth one is, I've already talked about it, and I'll go to the fifth one. Where is it? Yes, here it is. Fifth one. Acne is the result of poor hygiene. Many people think that acne is because of poor hygiene. They don't take care of their face really well. That's the reason they are getting the acne. No, it is not. If they are not taking care of their face, that's one thing. And if you are not taking care of your skin also, you can get acne. So, but if you have greasy food and you put your hand on your face with that grease, that can cause acne. And also, the acne is formed from oil which is getting clogged in the duct of the sebaceous gland. It comes from within, not from out to inside. Alright, so oil come from outside can cause acne, but not as bad as oil coming from inside. So greasy hands can cause, but poor hygiene may not cause. Okay, number 6, acne is caused by stress. It's true that some of the patient with stress will have more acne. But if you treat properly, and if there is any hormonal problem, if you treat properly, acne can be treated. And the sixth one, most of the people think spot treatment will cure acne. That is, they will apply the cream or the ointment only on the spots where they have the acne. That is a myth. No, because will be formed even before it is visible. It comes out. So you will have to apply the ointments not only over the acne, you have to apply the ointments or the cream on the acne prone skin, other surrounding the acne also. That's very, very important. Most of the people will apply the ointments or gel, whatever treatment the doctor is prescribed, they'll apply only over the acne. They will ask why should I apply the ointments on the other part? I got only here, only that part only I apply. So that we have to educate the patient that acne is already formed long before it comes out. So that's very, very important. And the 7th one is sensitive skin should be washed frequently. Wrong. Sensitive skin, if you are washing properly, it can aggravate acne. First of all, if you wash sensitive skin too frequently, especially with harsh soaps, alkaline soaps, it will aggravate acne, and because it will increase more sebum secretion that can clog the pores and it can cause flare-ups of the acne. And more than that, it can damage your skin also if it is a sensitive skin. If you wash frequently, you can use very mild pH friendly, that is like skin friendly cleansing lotion with a pH of around 5.5 lotion for cleansing the face. That's okay. That also, but only 2 times a day. Then what is the 8th one? We'll see. Only teenagers are the victims. That's wrong. Everybody thinks the acne is a disease of teenagers. It's not true. But most of the teenagers will have acne. But that doesn't mean only teenagers will get acne. Even the elderly people like 30s and 40s will get that. The studies have proven that even adult can get acne. And infant acne, that is very small child, and even child can get acne. Alright. So now we'll check what is the 9th one. Washing more often will get rid of acne. That is another myth. As I said, if you wash more, what will happen is you are irritating your sebaceous gland and there will be more sebum production and it can block the pores, will cause acne flare-ups. Okay. Now we'll check what is the 10th. 10th one is acne is contagious. People think, some people have very severe acne. People think when we touch the face of a person who has severe acne, he also will get it. Contagious, it's spread from one person to another person. It's not like this pandemic. It's not like any viral disease. It's not like any other bacterial infection. It's not contagious. This is caused by another bacteria living inside our glands, around the glands. So it is not contagious. It doesn't spread from one person to another person. Even if your friend or family member has severe kind of acne, it is not contagious. Believe me, trust me. That's the point. If you like that point, please comment on the comment box that I loved it. Okay? That's it. So now we'll check what is the 11th one. 11th myth is everyone will outgrow acne. People will think, yeah, I don't need any treatment for my acne. Why should I get treated? Because acne will go on its own. Why should I get treated? Why should I go to a doctor and spend time? So, people have this mindset. What you have to do? We'll have to advise them. Acne might go on its own, but what will happen? If it becomes severe, that can lead to scarring. We'll talk about it later, but this is the thing. So, it might go away, but most of the people will go to another stage. It's called non-cystic acne. There's a grade for the bigger grade that can cause scarring, and even if you go for laser treatment or the other big best of the treatment available for acne scar, it may not go. So remember that. So let's check what is the 12th one. 12th one is sunscreen will cause acne. Yes, if you use sunscreen, in greasy sunscreen like cream or lotion, it can aggravate or cause acne. But there are sunscreen available which is not comedogenic. That means it is not causing pimple. That it can cause. Most of the sunscreen that will be in gel form. But better than that will be sunscreen cloth. That is much better than any cream, lotion or gel. Trust me, that is the best thing. Sunscreen cloth. Our Pure Pharma has started off with, that is their own invention, with this sunscreen mask that will protect from bacterial or some viral infection, also dust particles. So we can wash it, it's very cheap, and you can reuse it. So use sunscreen gel or buy a sunscreen cloth. Okay, it's available. There's a UPF like ultraviolet protective factor 50+ and above, or this I think Pure Pharma is having 90+ above. It has been tested from the factory that it has got UPF around more than 200, 800 and all that. So trust me, that is the best sunscreen. And let's check number 13. 30 is acne affect both males and females equally. Yes, that's true. But in teenagers, boys are more affected because of the hormone called androgen. In boys, in the teenagers, the androgen activity is more. So in the teenagers, males are, like boys are affected more. So that's another myth and fact. So what is number 14? Nothing should be applied for sensitive skin. These are some kind of patient will ask, doctor, I got very sensitive skin. I cannot use this, I cannot use that. I use this, I use that. Then I got all the flare up. Now my skin is become dry and sensitive. They don't know that their whole skin is sensitive. So what they will do is they will try all the products and combination products, and some of them must have given some side effects, dryness or something. So sensitive skin has to be treated. That need doctor's advice. So such sensitive skin, acne gels are available, acne ointments are available, and cleansing lotion is available. So talk to a doctor and get it treated. And let's check what is number 15, myth and fact. Acne is seasonal. It is true that sometimes in summer it may aggravate. That's not true in all the cases. There is no season for acne. Acne can appear all the season, whether it will be summer, winter, autumn, any spring, any time it can happen. Even in rainy time or summertime, acne can occur. So there is no season for acne. Note it down. No season for acne. If you like this, please comment in the comment box. That is cool. Okay? Please comment. That's cool. Then let's check what is the number 16 myth and fact. 16 is sun helps to clear up the acne. It may be true that a little bit of exposure to the sun, like 10 to 15 minutes, that can give some improvement to the acne. But if you are exposed too much, then that can damage your skin and it can give a flare up as well. So, but the thing is that if you got back acne, a little bit of exposure, maybe for half an hour, will give you good improvement. So, back acne is okay for some, not for the face. Okay, got it? Okay. Then, what is the number 17? You cannot use moisturizer when you have acne. That is another myth. You can use moisturizer. Water-based moisturizer is available, and there are certain moisturizer which can be used for acne. But you'll have to talk to the doctor. The doctor has to see your skin and the type of acne. Then they will prescribe you a suitable moisturizer. Don't select the product from the net or Googling. Okay? Alright. So, then 18. Most of the people, especially senior people, think acne will go away with time. Yes, it might go. Most of the acne, like grade 1 or even grade 2, will go away with time. But what will happen if you don't get it treated? What will happen? It can go to other stages. Okay, so they don't know what stage it is. The patient don't know because they don't know about the skin, they don't know about the acne. What they heard, what the knowledge, what they are having is wrong information from the surfing, or maybe from the elder member of the family. So it might go away, but it can lead to scars. Sometimes will be blackheads and whiteheads. This is a grade 1. You can clear it up. It might go. Okay, this might go on its own. Sometimes can turn into pustule. That is a pus-filled acne, or nodule that is bigger than this, like this. Nodules. I'm sorry, the picture is not that clear when you zoomed it. Then cyst sometimes cause. Cyst is the bigger one. Nodules, infected, bigger one cyst. This breaks. Then that is gonna give you a scar which is depressed. That means there will be picking or different types of scars it will form. So you have to treat acne. It might go on its own, but you might be scarred for life unless you take a proper treatment. So now let's check what is number 19th myth. There is nothing you can do about acne scarring. Thanks to the modern technology. Technology has improved a lot. There are a lot of treatment for acne. There are chemical peels available, there are lasers available, there are RF like MNRF, fractional RF, fractionated lasers. All the things are available now, and RF substitution. So all will give you good improvement. There are small treatments like they call it dermarol, like micro needling, and small treatment like small peeling also is available. That also will give improvement. So sometimes it may be very expensive. So people can select because there are lot of new treatment which will give you good improvement. So whatever is possible for you, then go for it. Then you will get improvement. We cannot promise 100% improvement. Even if you take all the treatment, it's always better to take combination of treatment like lasers, peels, microneedle RF, fractionated RF, RF substitution. If you combine all the treatment, you will get a fantastic results. Okay, and also if treated, you will get a this is after picture of ours. You will get an improvement like this, minimum 60-70% improvement. You can see this patient, they got different types of scars. They got picture scars, they got rolled out scars, they box scars, all types of scars he has got. And after the treatment, you can find there is good improvement. Even after this, if you go for some more treatment, you'll get still a better result. Okay, what is the last one? 20th. It's okay to stop the treatment once the acne is cleared up. No, it is never okay. Because after 2 weeks of treatment, it might go away. You won't see any pimple, you won't see any trace of the pimple. What will think? The patient will think it's gone. No, it's not gone. As I said, pimple will start forming even before you start noticing it. Okay, so pimple will be there inside. So doctor can feel it. Okay, doctor can touch, palpate and see that pimple is still inside. They can make out with the experience. If you go to an experienced dermatologist or aesthetic physician, they can make out. From a distance they can make out. Then that's the thing. So doctor will decide how long the treatment is required. If tablet is required, you should take tablets, and different types of tablets is there, and all that the doctor will advise you. Accordingly, you take the treatment. Okay, that's all for tonight. I hope you liked it. If you liked it, please share and comment. I need the comments. Then only I can improve. Alright, so I'll improve more. I'll come back with another interesting topic soon. Till then, please take care of yourself and your family. And namaste.